Like and subscribe and click the bell icon to get new video updates.
The latest COVID-19 case numbers from around the states and territories. Here is a quick wrap of each Australian jurisdiction's latest COVID-19 statistics for Monday, April 18th. You can get a more detailed, visual breakdown through the ABC's Charting the Spread story here. You can jump to the COVID-19 information you want to read by clicking below. Queensland has recorded 4 new COVID-related deaths and 5,141 new cases in the latest reporting period. There are 551 people in the state being treated for the virus in hospital, and 19 of them are in ICU. Queensland's number of known active cases has dropped by more than 1,000 since a day earlier, down to 46,287 from 47,542. Today we have recorded 5,141 new COVID-19 cases. Sadly, we have reported 4 deaths in the past 24 hours. Full details https://tcomidwpide5pic.twitter.com/UGYACT, Queensland Health, @Colge Health, April 18, 2022. New South Wales. Another 11,166 new COVID-19 cases were confirmed to NSW Health over the Easter Sunday reporting period, with almost 7,000 of those via rapid antigen tests. 4 people with the virus have died and there are 1,576 people in hospital, including 67 being treated in intensive care. The state's hospitalization rates have risen slightly from the previous reporting period, up from 1,527 cases being treated and 64 people in intensive care on Saturday. In the reporting period prior to that, there were less than 1,500 cases in hospital with the virus. COVID-19 update, Monday 18 April 2022. In the 24-hour reporting period to 4 p.m. yesterday, 96.1% of people aged 16 plus have had 1 dose of a COVID-19 vaccine, 94.7% of people aged 16 plus have had 2 doses of a COVID-19 vaccine. pic.twitter.com/QBHO5LRW5U, NSW Health, @NSW Health, April 17, 2022. Australian Capital Territory. 2 people are being treated for COVID-19 in intensive care in Canberra, with 58 people hospitalised with the virus in total. Authorities reported 734 new cases in its Monday update, but no data was confirmed for Good Friday or Easter Sunday. Of the new cases, there was a near-even split between detections via rapid antigen tests and positive results via PCR testing. Victoria. 1 person with COVID-19 died in Victoria and 431 people are being treated in hospital, the health department says. The state has recorded 7,918 new cases, down from yesterday's increase of 8,153. Its number of known active cases has also dropped, from 57,567 yesterday to 55,168 today. Tasmania. There have been 1,372 new cases of COVID-19 recorded in Tasmania in the latest reporting period, up from yesterday's 1,212. There are now 9,372 known active cases in the state, down from 9,788 yesterday. 1 person is in ICU and 21 patients are being treated for the virus in hospital. Northern Territory. NT authorities say a man aged in his 70s has died with COVID at Royal Darwin Hospital. 2 people are being treated for the virus in intensive care, 30 are hospitalised in total. There were 386 new cases recorded. There are just over 3,000 known active cases across the territory. South Australia has recorded another 3,560 cases of COVID-19. There are 245 people with COVID-19 in hospital, including 11 in intensive care. The new cases represent a 33% increase on the previous 24 hours. The number of South Australians seeking PCR tests increased 21% over the same period. Western Australia has recorded 5,605 new cases of COVID-19, and no further deaths. There are 227 people with COVID-19 in hospital and 6 of them are in intensive care. There are currently 41,016 known active cases in WA.